Polio is an infectious disease that is caused by the virus poliovirus. Polio, also known as poliomyelitis, is crippling and deadly. This disease can be non-paralytic and paralytic. Non-paralytic symptoms include headache, neck and back pain, pain in the limbs, lethargy. Muscle spasms are also present in the neck and back. Paralytic symptoms include those of the non-paralytic disease, but also loss of muscle tone in the legs, trunks, and arms. This is because the spinal nerves are affected. Polio used to be very common in the United States and it caused severe illness in those that it affected. There was a vaccine that was discovered in 1955. Unfortunately, children who are under the age of 5 are those who are mainly affected by this disease. They are easily contracting this disease because they're not taking the preventative measures.
Polio reached its peak in 1952 with about 21,000 cases. In 1953, a vaccine was developed and 2 million children participated in the trials. And when introduced to this vaccine, the polio rampage declined by about 90%. The original vaccine was an inactive form of the polio virus, and then an oral vaccine was introduced, which helped decline even more. In 1979, the last wild case of polio occurred in the Amish country and was brought over from immigrant traveling. In September of 1994, the Western Hemisphere was certified and said to be free of polio. Due to the advancements in medicine, polio virus doesn't affect America hardly at all like it did in the past. The United States is fortunate enough to have dodged this disease. Countries like Afghanistan, Pakistan, and Nigeria aren't so lucky, and those are just to name a few. In these countries, the virus is still a prominent issue. Cases reported have taken a jump in the past few years in these countries. In 2014, Pakistan went into a red alert phase with a reported number of 328 cases. Within these countries, there have been 3 high polio transmission zones marked as highly endangered districts. Hoping to eradicate the problem like the U.S., these countries affected are aiming towards shifting their treatment options and administering it in different ways.
The best way to prevent polio, besides proper sanitation and a healthy hygiene, is to take the polio vaccine. The vaccine is called inactivated polio vaccine, or IPV for short. This vaccine is usually taken in 4 doses. The first one is administered at 2 months old, then 4 months old, 1 dose between 6 and 8 months old, and lastly at the age of 4 or 6 years old. The best way to avoid it is to get all 4 doses. For example, the percentage of the vaccine working just from going from one's 3rd dose to their 4th dose is a huge jump of a 90 to a 99% success rate. The countries listed previously have a prominent problem of the spread of polio. For example, in 2014, the country of Pakistan reached a red alert status with a whopping 328 cases reported. In addition, there have been 3 high polio transmission zones or hotspots for polio contraction. This is why it is very important to be aware when you're traveling outside the country. Since polio is not a huge problem in the United States, little has been done to raise public awareness on the issue of the polio virus. However, there are many organizations on the web that are trying to change this, such as the UNICEF USA organization, the Rotary organization, and TravelersHealth.com. There are also mission trip opportunities and opportunities to donate money in order to fund the eradication of this disease in the foreign countries affected. Thanks to the organizations listed above, the polio cases have decreased every year in foreign countries from 350,000 cases reported in 1988 to only 223 cases reported in 2012. It has also led India into joining the polio-free country list in 2014, and in 2015, Nigeria had a huge accomplishment with reaching an entire year polio case-free. In order to tackle the huge issues still remaining in Afghanistan and Pakistan, though, the government is trying to take steps into freeing these countries. Currently, the government has a 3-part plan in action consisting of Type 2 immunity basis, facilitating interruption of transmission, and immunity boosters of WPV1 and WPV3. This requires the government to facilitate and provide all 4 doses to the citizens of the countries, preventing transmission after, and having a plan in action in case a breakout were to occur from a world crisis of level 1 to a level 3.